Dr. Pathik joining us, and today's topic is about hepatitis. A lot of people, this is new, but I was also surprised. A couple of seconds back, I came to know it is jaundice, and but before we get on to talking about hepatitis and what are the symptoms, what are the causes, and why is it so important for awareness about hepatitis, vaccination about hepatitis, how is it as critical as COVID? So we will talk about all these points. Before we get started, I would request Shrenik sir to talk a bit about Dr. Pathik. Over to you, Shrenik sir.
Thank you. Thank you. Good evening, Dr. Pathik sir.
Good evening, sir.
And saluting your dedication and contribution for the community for years together. And I know that, being a super specialist, you are one of the most busiest medical professional ever. So, and honestly speaking, whatever I am doing, in last several years, the credit goes to you guys. I have learned so much. I've learned the dedication, contribution from you guys. I'm not a doctor. I'm not going to be doctor either. But I don't know, same with the case, even with Ravi. But then, we have decided to stream this Facebook Live e-HealthSeries. And Dr. Pathik sir, you'll be surprised that this e-HealthSeries is the first in the world as a CA learning survivor. This is our 20th episode. For 19th episode, so far we have received some 35,000 views and so on. One more reason I have to speak a bit. Yesterday was World Head and Cancer Day, so I by myself, being a serial learning survivor, I have celebrated by giving presentation. But important for today is World Hepatitis Day, and we have you on our board. So we request you to deliver what are the best you have your experience and expertise the medical technology application of medical technologies and so on. So once again, a very warm welcome, Dr. Pathik sir, and let's go from now. Over to you, sir.
Thank you, Shrenik sir, for your kind introduction. Actually, I am privileged to be talking to you today. So, as you said that you are a survivor, I think you are a fighter, a motivator. So, this talk is about more about being motivated and being positive about it. So, your entire show and people listening to it today, I think it's a great motivation for them that you should not be defeated. And 20 years after being diagnosed with something which at that time which was believed to be incurable, and you are still perfectly fine, and I hope you stay this fine and carry out many more episodes for the future, sir. So privileged to be a part of this.
Thank you. Thank you, sir. This is, he's really honored. He doesn't have any words right now to express. But yeah, Dr. Pratik, my first question: what is hepatitis? How serious it is? And a lot of people still in India don't know about this, and don't take this as something which will come and which is quite serious. So if you can throw some light about it. And before that, we would like to know about your journey into healthcare, and your experience till date before we get started, because the friends in this particular community, it would be nice if they get to know you well, and then we get started with the questions.
Yeah. So just to introduce myself, I am Pathik Parikh. I have been born and brought up in Ahmedabad. Did my schooling in Ahmedabad, did my MBBS and MD medicine from BJM Medical College, Ahmedabad. During my training in MD medicine, if you remember, in 2008, there was an what we call an epidemic of hepatitis B. And a lot of people from Odisha caught this hepatitis B and were actually died because of that. And I was one of the team members looking after those patients. So that made me realize that there is so much lacking in liver management and there is so much lack of awareness. So this is what I want to actually do, be a liver specialist in future. But when I passed out my MD medicine, there was no such degree available in the country for hepatology or liver specialist. So the only way to do that was to do a gastroenterology. So I opted for a medical gastroenterology, did my DM, aced it from Mumbai, and to pursue my dream, I went abroad. Went abroad to London, even US and Japan, and got skills in liver hepatology, liver ICU, liver transplant. Came back, had some experience from my mentors back in Mumbai, and for last 4 years now, I'm in Ahmedabad at Zydus Hospital as a hepatologist and liver transplant physician. So this is my journey so far. And coming to the first question, I think the most important question is, what is hepatitis? Now, when I talk about hepatitis, it may be even my family members, they don't understand that hepatitis is not something which is very far-fetched. Everybody sees them daily. So we recognize hepatitis as jaundice. So when I ask everybody, how many of you actually suffered from jaundice in your childhood? And a lot of you will say, no, I suffered from jaundice. But jaundice is not a disease. Jaundice is actually a symptom. The disease which causes jaundice is hepatitis. Just give you an example. Like if you suffer from fever, you don't say that I suffer from fever 10 years back. You tell them that you suffered from chikungunya, dengue or malaria 10 years back. The same way, when you tell that you suffer from jaundice, jaundice is just a symptom, but nobody is aware that we should be actually looking at the cause of this jaundice. And the most common cause is hepatitis, that is viral hepatitis. Hepatitis means any swelling of the liver. So whenever the liver is injured because of, irrespective of whatever etiology it may be, we call it as hepatitis. And when it is caused by virus, we call it as viral hepatitis. Coming to limiting myself to viral hepatitis, it is the most common cause of jaundice. Maybe you may be a 4-year-old child, 10-year-old child, you may be a 40-year-old or a 60-year-old. Whatever may be the age, the most common cause remains viral hepatitis. But the type of viral hepatitis that affects different ages is quite different. And the purpose of today's talk is just to create awareness about these different types of hepatitis on the occasion of World Hepatitis Day.
Yeah. Thank you, Dr. Pathik. What causes hepatitis? What's the root cause for that?
So, as I said, that hepatitis is anything which may be affecting your liver is called as hepatitis. But the root cause and the most common cause remains viral hepatitis. So when we talk about viral hepatitis, there are 5 most common viruses and there are uncommon viruses, which are very rarely seen. So 5 most common viruses are named according to their alphabets: viral hepatitis A, B, C, D, and E. We group them as 2 types. Like D is less common. D is always associated with viral hepatitis B. So we just divide this for simplification and for general public to understand. Is one type of hepatitis or jaundice which occurs because of poor sanitation and water, and which is transmitted by food, water, or by contact. And the other type of viral hepatitis is one which is dangerous, which in Gujarati we call it as Jahri Kamdo, and which gets transmitted by blood and body secretions. So A and E are the ones which we routinely come across as jaundice in our childhood or in adulthood, which is transmitted by poor sanitation. So you see a 14-year-old boy who presents to you, says that, he had jaundice for a month and then it subsided and it disappeared. There is nothing left of it. That is the routine type of viral hepatitis. But the ones which stay in your liver is viral hepatitis B and C. And most of the time it does not produce symptoms. You would not even know that it is there in your body.
Okay. So you mean to say the B and C are chronic? I mean, they have the tendency to stay there for a very long time? Okay.
Yes.
So
Probably for unless treated, it may stay for the rest of your life in your body unless they have been adequately taken care of.
Okay. Any symptoms? You were saying it is very difficult to predict, but how do we know that we have hepatitis?
So less frequently, but any type of hepatitis can start with symptoms like you have fever, nausea, vomiting, you feel fatigue, body ache, muscle ache, and after a few days of that symptoms, you start developing jaundice. So that jaundice persists for a period of few weeks and then it subsides. So this is usual with viral hepatitis A and E, or what we call as the routine variety of jaundice that we see. But viral hepatitis B and C may not cause any of these symptoms. It just enters your body and gradually starts proliferating in your liver, and very rarely such symptoms are seen, but otherwise you won't feel any of these symptoms. It just stays there and you won't even realize that.
Okay. Any way to detect this, and what are the how severe is this? Is this something like a fever which comes and goes? Don't we need to worry about it, or it's something that we need to really worry and take proper precautions?
So when something doesn't have any symptoms, that means we need to be quite alert about it. So if you have gone through any health checkups, you would know that hepatitis B always remains a part of that health checkup. Or anybody who undergoes any surgery, hepatitis B screening is being done as a part of pre-surgical evaluation. So the patient would not know about it. It is just by actively getting it investigated they would realize that they have been exposed previously. Like most of the time that we come across in our practice are people who have taken some intramuscular injections for fever or pain in their past. And they got that, and those syringes were unsterilized, and they got it from that syringes or needles, and that it stays there. Only after 5-10 years, when we undertake certain basic tests, we pick up this virus. Otherwise, patients do not realize that they are suffering from this virus. In fact, this is not the scene in India. Worldwide, if we see 90% of the people who actually suffer from this virus do not know that they are suffering from this virus. So it may be a developed country where people are more educated. Even then, the situation is not different from Indian standards.
Okay. Is this contagious? Is this infection like COVID, where it passes on from a person to person? And if yes, what are the ways it gets transmitted?
So hepatitis A and E, as I said, they are the routine type of viral hepatitis which we commonly see. They get transmitted by contamination of drinking water, by feces. So usually it's a fecal-oral transmission where poor sanitation is the major reason. But the best part is sanitation prevents this transmission. But when I talk about hepatitis B and C, it gets transmitted by body fluids. When I talk of body fluids for a general person, it is by blood. So it gets transmitted sexually, also by blood products. So if a blood product which has not been screened and it is transfused to a person, then he may catch it. IV drug users, so if there are sharing needles among themselves, they may get hepatitis B from one person to another person. Certain things which we all come across is razors. When we go to a barber and the razor, so the blades, if they are used, they can transmit the disease. The tattooing needles, the piercing needles, sometimes acupuncture needles, if they are not properly sterilized, they can transmit the disease. But the most important is a mother can transmit the disease during the delivery to a newborn child. And that is why all pregnant women need to be aware of the disease and they need to be screened to prevent it from being transmitted to the next generation.
Okay. So doctor, what are the risk factors? What are the, like you're saying, some of these things cannot be detected, but kya losses hai? What are the risks involved if somebody is not going to the doctor, not getting proper diagnosis for this?
So if somebody is not taking care and catches the virus and they would not know it, so the virus over a period of next 10 to 20 years, so that's a long period for being completely asymptomatic. So people would not remember when did they catch the virus, and it is very difficult. Over the next 15-20 years, the virus starts replicating into the liver. They start destroying the liver, weakens the liver from inside. And only when the liver becomes most of the time above 80% damaged, that is when they start developing symptoms, and that is sometimes too late. So they may have a complete liver failure. For example, if you have seen somebody developing liver disease after alcohol, you may end up exactly similar situation. But other thing that we are worried about is it can even cause cancer. And in India, the most common cause of liver cancer even today remains viral hepatitis B and C. More than 80% of all liver cancers in the country are caused by these two viruses. So if you are not aware, the first presentation that you may have is some abdominal discomfort, some pain in your tummy. You get yourself evaluated and it's already a cancer. So it's quite risky.
So, Dr. Pathik, is there any vaccine that can, avoid this? I personally know me and my wife got vaccinated at this particular age, 2 years back, where the doctor highly recommended about hepatitis B vaccine. But, what steps can people take to ensure that they are vaccinated, like COVID? Like people are serious about vaccination now. So, what are the steps you suggest?
So, first of all, it's very nice to hear from you that you have got actually vaccinated just recently. So, just want to stress on the fact that hepatitis B vaccine can be taken for all ages, and if you have not been vaccinated, you can get tested now, get a routine screening test, and if it is negative, everybody should be vaccinated. Now, coming to vaccine, Indian government has taken a lot of steps. So beyond 2002, gradually over a period of next 10 years, they have incorporated entire country into universal immunization program. So that means anybody who is born after 2002, as a part of routine immunization, like the polio and the BCG who get in the childhood, all children are getting vaccinated after those who are born after 2002. But unfortunately, when we talk about those who are born before 2002, like us adults, the concept of adult vaccination is not existent, and we talk about vaccination to adults, they say, no, I don't need any vaccination. They are scared. I think you took a vaccine now, and even I took the vaccine of hepatitis B once I became a doctor. So, and now because of COVID, people are realizing that vaccination can be given to adults, and it is must in actually. So all adults who are not vaccinated should get themselves tested, and if they are negative, they should be vaccinated, especially because we do not know how this virus would enter. For example, as I said, when you go to a barber for a haircut, it may get into you. So better to get vaccinated, because the chances that the vaccine is going to protect is more than 99%.
Okay, that's a good point, Dr. Pathik. I think you touched on a very sensitive point. Adult vaccination is something which people are not yet accepting, and nowadays they're open to it. So I think this is a good point. How important is creating awareness about hepatitis, especially during the World Hepatitis Day?
So the entire purpose of this World Hepatitis Day is to create awareness about this deadly viruses, and both the deadly virus needs to be tackled. Now, unfortunately for hepatitis C, we do not have a vaccine as of now, but hepatitis B, we have vaccine, and all adults are susceptible. So it's a 3-dose vaccine, no side effects, no complications, and extremely good efficacy, more than 99%. So on this World Hepatitis Day, my entire message to everybody who is listening is to consider themselves for vaccination. It is that thing which is at least not going to protect you from all the diseases, but at least one at a time we can tide over this crisis. And only once we all get vaccinated, the percentage of this virus would go down. And the target that has been set is to prevent hepatitis B and C from becoming a public problem by 2030. So we have 9 more years to actually curb this disease in a better way.
Yeah, Super. As a common man, how do we spread awareness about this? Like, if you're coming onto the show, but as a common man, how do they ensure that their family members are safeguarded, their friends and relatives are aware of this, and they need to do this, and what are the steps they can do to contribute to this?
So, see, hepatitis B spreads exactly similar to how HIV spreads. So people are scared about HIV, but they don't understand that hepatitis B is 100 times more likely to get transmitted by blood than HIV. So you should be more worried and should take similar precautions like the way you take for HIV. For example, you go to a barber shop, you tell them that to use a disposable blade, or make sure that the instruments are sterilized. You go to a tattoo parlor, you make sure that they do not reuse the needle. Most of the time, you go to some place in remote periphery where you develop some symptoms and you need an injectable. So make sure that the syringe, the needle, everything is single-use device. Nowadays, there's no concept of sterilizing needles and syringes. It has to be a single-use device, and it is being discarded immediately after you get injected into. Never, no for drug use. If you are a sexually active young individual, make sure you use a barrier contraception to protect you. If you don't know about the vaccination status. So these are basic guidelines, and the best way still remains the vaccination.
Okay. So those are all the questions I had. Shrenik sir, do you want to add on? Do you have any other questions?
Yeah. Sir, I have very particular question.
Yes.
Particularly about the new generation when newborn babies
Yes.
are born. The maternity home. They always saying that the baby is having a kind of hepatitis B, and some treatment is given, and in a week's time the baby is getting back to normal. So what exactly is that?
So, see, a newborn who is immediately born, it is impossible for us to 100% know that whether he would get affected by hepatitis B or not, because a newborn does not have his own immunity. So all the tests that we carry out are actually detecting something which is being transmitted to that person from his mother. So because we breached this newborn thing, we need to understand that mother to child transmission is a major hurdle. So all pregnant women during their antenatal checkup, they get a lot of blood tests done as a part of the routine screening. So hepatitis B and C should be a part of their evaluation program. Once hepatitis B is being diagnosed, they should contact their local liver specialist and get in touch with them and stay under their close follow-up, so that by the time they become, there comes a time of their delivery, the virus is not present into the blood. And as soon as the baby gets delivered, the baby should be vaccinated immediately at birth, and there is something which we call as hepatitis B immunoglobulins, which would take care of all the viruses which have entered into the baby during the process of birth. But even then, we would not know whether the baby is infected or not. So when the baby becomes 9 to 18 months of age, that is when we start carrying out blood tests to detect whether the baby is affected. But if the mother is taken care, mother is being treated during pregnancy, and the baby is vaccinated as well as given immunoglobulins, the chances that the baby would catch the virus is very low.
Sir, in continuation to what you said,
Yes.
is it a standard protocol being observed by the gynecologist of advising such tests of hepatitis B or kind of a screening during the pregnancy? Is it a standard protocol, or it is not, because this is very important aspect for the community, for the pregnant woman, or rather expecting the ladies expecting the babies.
See, before a few years, the guidelines didn't incorporate. They said it's suggested, but now hepatitis B screening is must during for all pregnant ladies, and gynecologists are being aware now. They are also in the process of accepting that hepatitis B screening is a routine screening process, and as a part of screening, all pregnant ladies should undergo. Hepatitis C was not officially recommended. It was suggested, not recommended, but now even hepatitis C screening is being recommended for all pregnant ladies. So B and C should be screened during at least once during a pregnancy.
And by any chance, if the pregnant lady is diagnosed with such particular issue, is there any chance or rather is there any necessity of termination of the pregnancy, or just this can be taken care of simply by medication?
Even if a pregnant lady turns out to be positive of either of the virus, there is nothing to worry about it. We have wonderful strategies to prevent transmission. As I said, that we continuously monitor the lady during pregnancy, and we make sure that the virus remains at a very low level during the entire pregnancy. And even during the childbirth, the virus is not in the blood, so the chances that the baby would catch would be negligible in the current era. We would take care of that.
Interesting. Dr. Madhijan, see, I mean, this is what we are doing together, that is myself and Ravi. So, we are trying to touch only those topics which are relevant, which are supportive to the community in general. And that is why, I mean, we wanted you to be here on our platform. I mean, yes, we have done so much on oncology and other topics, but this hepatitis B, that is the first time ever we are being sharing, or rather we have asked you to share the knowledge with the community. Thank you so very much, Ravi. Over to you now.
Yeah.
Can I add on to something?
Yes, please.
Before, yeah. So something which I wanted to talk about is the treatment of this too. So we have always talked about preventing, but what if you actually catch this virus? So I have talked that it has very poor outcome. It may even kill you. It may cause cancer. But thanks to the modern medicine, we have come across beautiful treatment. So if 10 years back you would have come and said that you have caught hepatitis C, and I would say now you are for a rough patch of treatment, you would be facing a lot of side effects, a lot of injections, and yet the success rate is going to be just 40-50%. In the current era, 2021, we have wonderful drugs. So if we talk about hepatitis C, 3 months of therapy, just 3 months of treatment, one tablet a day, and you are cured 99.9% of the times.
Wow.
And the cost of the therapy, now you should be lucky that you are in India. The cost of the therapy in US is 84,000 US dollars for 3 months of therapy. And it is the same company, same molecule is available at 30 to 35,000 Indian rupees for 3 months of therapy. So it's quite cheap, it's quite safe, just one tablet a day at 3 months and you would be cured. So even if you have virus, nothing to be worried about, don't panic. Just approach your doctor, your liver specialist, and with the current treatment available, you will be cured.
Wow.
Madhijan,
Yes.
I'm rather grateful to you for this last few minutes talk. The reason is during all my these talk shows, particularly for the Indian community, I keep on repeating the word, or rather the approach, that for any kind of treatment, unless you don't have a fancy of spending money or telling people that okay, I got my treatment done in US or London or Australia, there is no point, no need of going outside India for the treatment, for a simple reason. Indian doctors are truly, truly big human, number one. Number two, they have tremendous exposure every day and night. I mean, treating the patients and stuffs like that, and whatever the experience they have. And let's not forget that doctors are not our enemy. So these are some of the stuffs, and that is, I mean, whatever I have said earlier, you had to kind to endorse my previous statement and your my today's statement. Sir, one more question I would like to ask. We just you just mentioned about the cancer of the liver, and I myself being a cancer survivor of God's for a larynx. So, what are the treatment protocols, survival rate for liver cancer? Number one, and number two, what are the other options available like liver transplant? Because just like heart, kidney, we need to save liver as well. So kindly over to you, sir.
Yes. Coming to liver cancer. So, liver cancer, if diagnosed early, like any cancer in the body, the main target, that main screening that we do is to diagnose at an early stage. When the tumor is less than 5 centimeter in size and it's quite early, we can offer permanently curative treatment. So the curative treatment, we can just cut it out. Either we can burn it out by, if it is less than 3 centimeter, a single sitting, there's a small needle and it burns out the complete tumor. And even then, the liver transplant remains an option. If we look at the Western world, in the Western world, liver cancer is the most common reason people are getting transplanted. So liver cancer transplant is possible, and once you get transplanted, you live normally because the bad liver which caused you this cancer is out. You are with a new liver and you may live normally. Coming to again liver transplant is, there is some skepticism about liver transplant. People are scared. People still feel that transplant is not successful in liver as much as in kidney. But I would speak otherwise. Liver transplant is quite successful with a survival rate of more than 90%. And Indian survival is far better than the Western countries again. Indian doctors, Indian surgeons are doing wonderful job. They have wonderful skills. And once you are transplanted, although you remain on certain amount of medicines, but you tend to live a completely normal life. Beyond 3 months of transplant, you can live as normal as anybody else. You can work, you can live professionally, you can even play cricket, I would say. So just give an example, in Birmingham, at Transplant Center, my teacher used to organize cricket matches between the transplant recipients and the doctors, just to prove to the world that even after transplant they can play cricket and they live as normally as anybody else.
Wow. Super.
Last question, Dr. Pathik, please talk about your publication, about your book or papers you have published.
Yes. So, as I said that there's some fear about liver transplant. It's not just about general public. Like general public, I can understand that they would be scared because it's a major surgery and an expensive surgery. But even the doctors believe that it's not a successful thing because 10 years before, it was not so much established treatment in Gujarat, and even in entire India, beyond 2002, 2003, only liver transplant has picked up to such an extent that we would be one of the highest transplanting countries of the world, and we have so much medical tourism now, people coming from abroad also to get liver transplanted. So just to make people aware about how transplant is, what are the things which we need to understand, because now all doctors would come across people who would see patients who are transplanted somewhere or other. because the transplant survival are more than 20 years to 30 years. So even if they develop fever, they would go to their local physician, and people get scared. No, you have got transplanted. I won't treat you for this because they have not been trained for it. So just to make physicians and all doctors aware about how to deal with this day-to-day transplant problems, we have come across all transplant doctors from Gujarat and Maharashtra. We have compiled a book which we are trying to, which is easily available, and if anybody needs it, I can personally give it to them, and which deals with our day-to-day issues about liver transplant.
Sir, we would like you to share the link. We will cover it, or rather we will publish it while sharing this link for the public, so that they can easily read it out and reach out in case of necessity. I mean, knowledge is far better than ignoring it, or not being aware of what exactly stuffs are available in the for the Indian community.
Yes, thank you, sir. And this book is specifically written for Indians' perspective, and this is first of its kind in India as a handbook. So you don't need a complete big textbook. It is a small book, like a handbook, which everybody can keep it on their coffee table and can go through it as and when they need it.
I was aware about this book. I have seen your article, and there was in that time I was after you for inviting on this platform.
Thank you, sir, and it has been indeed a pleasure being on this program with you, because I couldn't make it because of this COVID wave and COVID pandemic. But as I had promised on our first discussion that we would have a show together, and on this very important day for the liver, I think this is for a liver doctor, this is the most important day of World Hepatitis Day. We are having this program. So yes,
thank you.
Thank you, yes, sir. Thanks a lot, Dr. Pathik, for joining us on the show. Before we end the show, any suggestion for the audience, friends who are watching this particular show?
Yes, so the message is very clear that don't just take any disease as a disease like jaundice. Please ask your doctor what is the cause of this jaundice. Because sometimes you may pick up something. Stay aware of the reasons why you can get this disease. Avoid all the high risk things which can cause you this. And finally, protect yourself from this by vaccination. It is very good, safe, effective, officially recommended by Indian government. And even if you catch it, don't hesitate to come forward, get it treated, and be cured, and have a safe life.
Thank you.
Thank you, sir. Thanks a lot for coming on this particular show. And you've given awesome statistics, awesome details, symptoms, cure, and you most importantly, you've created the hope, to the friends out there that be careful. But in case you contract hepatitis, there is cure available. And the best thing I learned from this particular show, the treatment which costs $84,000 in the US costs less than $500 in India. So very
same brand, same company,
same molecule. It costs like a fraction of this. So thanks for sharing this. And
yeah, Ravi, let's inform Modi Sahib that against oily want we provide this liver treatment and stuff like that, so that the foreign exchange can be pretty well balanced. I mean, as against $84,000, this is 35,000. So it's kind of a miracle.
True, so true. So, Dr. Pratik, thanks a lot again for coming on the show. From me and Shrenik sir, and from WurkTV, we thank you for your time. Have a great day. Thanks for the contribution to the society.
Once again, thank you so very much. It was really a pleasure. Having you on our platform, and we look forward to have you once again on this platform over a period of time. Thank you so very much.
Thank you, sir. I'll be looking forward to be a part of it again as well. Thank you, sir.
Thank you.
Thank you, Ravi, for hosting it.
Thank you, friends. Do spread this word out. If you're not aware of hepatitis or jaundice, share this video and spread awareness. Talk about it. Talk to your friends. Talk to your relatives. Check out. Get yourself screened the next time you're going for a screening. Check out if you really have it. If yes, meet your doctor and get diagnosed. Thank you. Thank you, friends.